Here is exactly how the MBLEx works and how to pass it. The Massage and Bodywork Licensing Examination stands between massage school and a state license, and it is delivered in a way most candidates are never warned about. One question at a time, in a fixed order, with no way back. The MBLEx is written by the Federation of State Massage Therapy Boards, the FSMTB, and delivered at Pearson VUE testing centers. It is a single national exam that essentially every regulated state accepts. But the FSMTB does not license anybody. Passing is not a certification and not a license. Your state board issues that, and the FSMTB only reports your result to the board you named within 5 business days. The exam is 100 multiple-choice questions in 110 minutes. Your appointment is booked for 2 hours, and that extra time is not testing time. 5 minutes for a security agreement, 5 for a short survey, and only then does the exam clock start. Call it a little over a minute per question. Here is the part that surprises people. The MBLEx is a fixed-length computer adaptive test. Everyone answers exactly 100 questions, but which questions you get is decided as you go. Answer one correctly and the next is slightly more complex. Miss one and the next is slightly easier. Because the exam picks your next question from your last answer, you answer in the order presented. No skipping, no flagging a question to revisit, no changing an answer once you have moved on. And when the questions start feeling hard, that is not a warning sign. That is the test finding your level. Which leads to the most important sentence in the candidate handbook, printed there in capitals. If you do not complete all 100 items within the allotted 110 minutes, you will fail the exam. Not a partial score. A fail. There are no scheduled breaks, and if you step out, the clock keeps running. So pace it, about a minute a question, and when you are stuck, take your best answer and move. Your result comes back as pass or fail. There is no percentage to aim at and no scaled score on the report. The standard is criterion-referenced. Licensed practitioners working with psychometric professionals define the minimum competence needed to practice safely, and the FSMTB board adopted that as the bar. You are measured against that fixed bar, never against the other people testing that day, so there is no curve. Fail, and the test center gives you a diagnostic report by content area. Build the retake around it. To be eligible, you do not have to have graduated. Being enrolled in an approved massage therapy program and trained in all the subject areas of the content outline also qualifies you. Your school verifies that directly with the FSMTB through the Education Verification Center. You cannot do it yourself, so chase your school until it is done. Then comes your authorization to test letter, and you schedule with Pearson VUE, not with the FSMTB. Check the name on that letter, because it must match your 2 forms of identification exactly. So what is tested? 7 content areas, each with a published weight, and the top 3 carry almost half the exam. The largest, at 17%, is client assessment, reassessment, and treatment planning. The whole arc of a session, from intake and postural assessment through palpation and range of motion to the reasoning that turns all of it into a plan. Ethics, boundaries, laws, and regulations is 16. Benefits and effects of soft tissue manipulation is 15. Of the remaining 4, one is bigger than its name suggests. Guidelines for professional practice, at 15%, is hygiene, sanitation, draping, body mechanics, and business records. Pathology and contraindications is 14, kinesiology 12, and anatomy and physiology 11. Those weights quietly overturn how most people study. Anatomy and physiology is the smallest area on the exam, and with kinesiology it is still under a quarter of your questions. Ethics plus professional practice is 31%, and adding client assessment brings you to 48. Nearly half this exam rests on judgment, boundaries, safety, and how you run a session. Memorizing every muscle attachment is the most reliable way to feel prepared and still score badly. 3 real questions from the bank. First, at intake, a client mentions that for 2 days one calf has been swollen, warm, red, and painful to touch, while the other leg looks normal. What do? Withhold massage and refer the client for prompt medical evaluation. Those signs in one calf are classic for a possible deep vein thrombosis, and even light pressure can dislodge a clot that travels to the lungs. You are not diagnosing. You are recognizing a red flag and referring. Second, a regular client invites you out to dinner and says, "I don't mind mixing business with friendship, it's fine with me." Who is responsible for maintaining the professional boundary? You are. You hold the expertise, you control the room and the session, and your client is undressed and draped, so the relationship is never between equals. A client's agreement does not make a personal relationship acceptable. When a boundary question offers shared responsibility as an option, that is nearly always the distractor. Third, a new client reports right shoulder pain that came on gradually over several weeks, with no known injury. After the intake and visual observation, which assessment comes first? Active range of motion, with the client moving the shoulder unassisted. Active comes before passive and before resisted, because the client controls the movement and stops at their own pain. It is the safest starting point, and it shows you what they can produce before you move that joint for them. So how do you prepare? 4 things. 1. Drill practice questions until the rules are automatic and drill to well above passing, because on a timed adaptive test hesitation costs you more than it would anywhere else. 2. Master the vocabulary because these questions turn on single words. Contraindication versus area of caution, boundary crossing versus boundary violation, active versus passive versus resisted. 3. Take notes on every miss and weight your study toward the points. If practice shows you weak in ethics and professional practice, that is 31% of the exam, and it is the fastest content to repair because it is reasoning rather than memorization. 4. Read the whole scenario and all 4 options before you commit. You cannot come back. Then commit and move. Quick recap. 100 questions in 110 minutes, adaptive and in fixed order. Finish all 100 or you fail outright. Pass or fail against a fixed standard, never a curve. Anatomy is the smallest content area, while assessment, ethics, and professional practice are close to half the exam. And the habit worth more than any single fact on test day. Answer, commit, keep moving. Practice free at .com/en/MBLEx all 5 content areas. In English, Chinese, and Spanish, no. Good luck on your exam.